So how do we diagnose fibromyalgia? I was sent to a rheumatologist 20 years ago. I walked in the room and she said, "Why are you here?" And I said, "Because my doctor thinks I'm crazy. I have a lot of joint pain. He sent me to an orthopedist. I have nerve pain. He sent me to a neurologist. He has sent me to a nutritionist who actually told me I ate better than she did. He keeps sending me to doctors. He keeps putting me on medication. There's no explanation why I have so much widespread pain, so much numbness, so much lethargy, so much flu-like symptoms. So now I'm here to see you to see if maybe you can figure out what's wrong with me. Because frankly, I think my internist thinks I'm crazy." She said, "Well, let's give you a test for fibromyalgia, although I don't think you have it." And I said, "Why would you say that?" And she said, "Because you look good." I said, "Well, I make a concerted effort every day to do my hair and makeup and to get dressed nice for work because frankly, the better you look, the better you feel." She said, "Okay, well, let me explain how the testing goes. I'm going to be touching 18 points on your body. They're called tender points. If 11 of the 18 points are sensitive, you have it." Well, I burst out laughing. Like, that's the stupidest thing I've ever heard. You're just going to poke me in different parts of my skin, and that's it? There's no blood work. There's no scans. And she said, "It's all we've got." I said, "Okay." So she said, "Take off your cowboy boots." So I took off my cowboy boots, and the first thing she did was she touched somewhere around my foot. And I was, ah! So that hurt. I didn't know I had any pain really in my feet. She said, "Interesting." So then she went to touch a spot on the inside of my knee, and my foot actually jutted out, and I kicked her. And I started to cry. I go, "Holy shit, that really hurt." And she goes, "Okay." And I'm like, "I'm sorry." I felt really bad, but my reaction was to like jump because it hurt. So she goes through my whole body, up my right side, down my left side, just seriously poking me. It was just so dumb. But every time she poked me, it really hurt. So she sits back down when she's done. She crosses her leg. She kind of shakes her head, and I go, "What?" She said, "I don't understand. I've never met anybody who was 18 for 18. And you just don't fit the criteria of a normal fibromyalgia patient. Normally, people with fibro are extremely depressed, very, very lethargic and tired, and they tend to be overweight." And I said, "Well, I've got a little anxiety, but I'm not a depressed kind of person, and I don't like to be overweight, so I try really hard not to, and I don't have time to be lethargic. I got shit to do." So she said, "Well, you most definitely have it. You're not crazy, but I'm sorry to say I have 10,000 arthritic patients, and I don't have any room to see you again. There's really nothing we can do for you. We can give you medications to mask the symptoms, but at that time, there was absolutely no treatment. So it was really nice to meet you." So I go into the car, and I'm sitting there, and I just started to sob. Okay, yay, I'm not crazy, but jeez, there's something wrong with me, and nobody can help me. It was one of the most frustrating but relieving moments, like I can't even explain. So if you're going to get tested, somebody's going to come and just poke you in 18 different spots. Just go with it. For some reason, it seems to work.